Hi everyone, welcome back to my channel H&E Life. My name is Dr. Cindy Wang. I'm a practicing GI pathologist. Today's video is something that a few of you have requested in the past, and it is regarding some cons about pathology. In my channel, I seem to talk a lot about why you should go into pathology and the reasons why pathology is an awesome career choice, but I guess to be fair, I should say some of the negatives that are associated with being a pathologist. And honestly, like I said, once again, these negatives can be pluses to some people depending on who you are. So I'll talk about the biggest con there is about pathology, and unfortunately that is very little to almost no direct patient care. We take care of patients all the time as a pathologist, but not in the sense that we don't see patients, we don't really touch patients, we don't really interact with patients in any way, except for a very few specific cases in pathology in which you could be a blood banker or you can be a cytopathologist. So in blood banking, when you run the apheresis service, you would be able to interact with the patients directly as their medical doctor while they're in your clinic doing their apheresis. And a common example of this, sickle cell patients come frequently to get their red blood cells exchanged so they can remove the sickled red blood cells and have it replaced with good red blood cells. While they're in your clinic for the 2 to 3 hours a red blood cell exchange happens, you are that person's primary doctor. If they have any sort of reaction, you'll be the one prescribing medications as needed. And until they're out of your clinic, you are in charge of their medical care at that moment. And a lot of times these sickle cell patients, especially the sickle cell patients, they are kind of frequent flyers. They will come once a month, once every other month to get their red cell exchange done. So you'll also still have kind of continuity of care that way. The other opportunity in pathology is cytopathology. As the cytopathologist, you'll be able to go to clinics when the clinicians ask you to come do an FNA, and you will be able to go to clinic. You'll have to get patient consent. You'll do the procedure, and then you'll tell them the results soon after as a preliminary result, of course. And that's really the two major times when a pathologist sees and directly interacts with patients. And unfortunately for a cytopathologist, there's very little continuity care because usually you're only there to take one FNA and then the patient probably won't need another FNA for a while or ever again. So you do it one time, you meet the patient, and then they kind of just go on their merry way. A second con, which is basically very, very, very linked with the first con, which when you don't have patient or when you don't have direct patient interaction, you kind of don't get any glory as being a doctor. So pathology as a field is for people who are okay without having that like big, oh my God, thank you so much, doctor, you saved my life moment. Because unfortunately in pathology, you're going to never get that. Because we have so little patient care, all of the thank you would be to the surgeon, to the oncologist, or whoever is treating the patient who had sent you that tissue sample. If a patient comes with a suspected mass and the surgeon takes a biopsy and they send it to you and you come around telling them you don't have cancer, you don't tell the patient that. The surgeon who does the procedure looks at the pathology report and then reports back to the patient the biopsy was negative and you don't have cancer. At that time, the patient would be like, oh my gosh, thank goodness I don't have cancer. And when that happens, they're gonna be like, thank you so much for, whatever you did, surgeon. Whereas, no one's gonna acknowledge is the pathologist who looked at the tissue and diagnosed no cancer. So it's like that. If you ever want to be thanked for your job, pathology is not it. We really don't have our surgeons thanking us for working our butts off, making very complicated cancer diagnoses. It's oftentimes very, very thankless job. And for me, I don't care. I'm more than happy to be in the background doing my work, doing what I enjoy doing. But for some people, that's a big turnoff. All right, the third most talked about con in pathology is the pay. Unfortunately, pathology is not among the well-paid subspecialties. That said, we're not the worst paid subspecialty either. It is pretty, I guess, average to below average, but as a doctor, you still make a decent amount of money. A lot of pathologists practice in the academic setting, and these pathologists are usually the ones that get paid the least. And salaries for academic pathologists, and depending on which state you practice in, the salary can start at $150,000 or $160,000. And if you are in a private practice setting, it can go much higher. Sky's the limit when you're private practice, right? Because similarly to any other subspecialty who's private practice, you basically, as if you sign out a ton of cases, then you make a lot of money. But it's also kind of about what you want to do. For me, I really liked being in an academic setting. I really enjoyed teaching residents, and I was okay with taking a pay cut so I could sign out just GI cases. Yes, the pay, I wish I got paid better, but I'm okay with how much I get paid. The fourth biggest turnoff for, I think, med students, especially when they are looking into pathology, is just the super steep learning curve. Because in medical school, year 1, year 2, it doesn't really prepare you for pathology. Yes, you do a pathology course when you're in second year medical school, but it's kind of so dumbed down, so basics. You just see still pictures of images that correlates with the disease you're talking about in class. You really don't see how a pathologist actually gets to incorporate all this information to make a diagnosis. So that kind of way, it doesn't really give you what you need in terms to understand what a pathologist really does. The other thing is in your third year and your fourth year, in your clerkships, you have required clerkships in most of the major in medicine, surgery, neurology, so on and so forth. So you get a wide experience, and a lot of skills you have from one area kind of goes and connects to the next area. So the skills you learn on the wards in medicine, you could apply it to when you go to surgery, because even in surgery, you still have to check in on patients, right? History, do a physical exam, all of those skills translate. And then similarly, if you went for, instead of medicine, then you went to neurology, a lot of skills you learned in your press clerkship can be applied to neurology. Unfortunately, all the things you learn in your clerkships does not really help you in pathology, because what we do is just so different. So because of this little exposure and how little the stuff you learn in med school applies for pathology, once you start as a resident, the learning curve is quite steep. And then saying that, this will just go into the fifth con that I have to say about pathology, which is, once again, honestly, I think some people might see it as a pro, which is the further subspecialization needed. As in pathology, it's becoming the trend where everyone is getting subspecialized in something. Before, I don't know, say 20 years ago, you go through a residency and then you could go out and you could practice any subspecialty you want, and you sign out as a generalist. And that happens even in major academic centers where people are all generalists and then they sign out a little of everything. But nowadays, especially in the academic centers, you're not really going to get to practice as a generalist anymore, because most academic centers are split into subspecialties. So you're going to have to pick your one, maybe two subspecialty you want to sign out. So when you subspecialize, you then have to do fellowship, and fellowship is additional training on top of your residency. So because of this trend where pathology is becoming more and more subspecialized, training by default, even though it's not considered, required, you kind of almost have to do a fellowship, especially if you want to practice in an academic setting, and that by default would add an extra year or two depending on what subspecialty you want to sign out. Even in the private practice settings nowadays, when they hire people, they tend on their posting be like, we would like an APCP person who can sign out general but have subspecialties in, say, GI, GYN, Heme Path or something. So even the private practice setting, where even though you sign out general, they still want to hire someone who can sign out general but is also subspecialized in case difficult cases come up and you're the subspecialty expert for that practicing group. Unfortunately, I don't see this changing, and this is the trajectory in which pathology is going. So subspecialization in pathology is going to be there, and it's definitely not going away. So the final big con I want to say about pathology is that, unfortunately, especially when you're doing residency training, you have to handle a lot of not so nice stuff. You have to handle a lot of bodily fluids, a lot of blood, poop, dead bodies. So there's a lot of interactions with potentially infectious entities. So for example, when you're doing an AP training, you'll have to do autopsies. And autopsies, you have to sit for the boards, do autopsies. You cannot go through residency if you want to be an anatomical pathology trained pathologist to not do autopsy. It is not possible. The boards require it. So you will have to, yes, then work with dead bodies. You will have to do a minimum of 30 of them. So you have to see at least 30 dead bodies. And autopsies are not limited to just adults. You also have fetus autopsies. You also have newborn autopsies. You, of course, also have child age autopsies, but majority of medical autopsies is adults. That said, if you are very, very uncomfortable with dead bodies, I'm sorry, I don't know how to help you with this. The other thing you have to do if you want to be an anatomically trained pathologist is you have to grow specimens from the OR. So from the OR, you could get anything. You could get the uterus, you could get a colon, you could get a leg from amputations. So you have to be okay with, touching these organs, cutting these organs up, potentially being exposed to blood, urine, poop, and all of that stuff. Of course, I'm not saying you're for sure to get infectious disease by working in pathology. We provide in pathology when we're touching, when we're dealing with any human parts at all, we wear a lot of protective gear. We have gloves, we have goggles, we have gowns, we have whatever, face shields, whatever you want to protect yourself, it's all offered to you in terms of protection, but it's a risk. I have, of course, like many people, have cut myself while I'm grossing and while I'm doing autopsies. There's I'm not sure if you guys can see it. I have this scar right here on my middle finger, and it is from cutting myself in the middle of an autopsy after I have already removed the bowels and my gloves been exposed to blood and poop and urine and all that. And then when I was cutting, I accidentally cut myself. So now it was quite a big cut. It was almost to bone. So I have a huge scar, but I'm completely fine. I was able to immediately get tested for everything, and it came back negative. So that is a hazard for the job, especially when you're in training. As a faculty now, I don't have to do any of that anymore because the residents do them. But that's because I'm in the academic center. If I wasn't an academic center, some in private practice groups and smaller community hospitals still have their pathologists grossing. So as a pathologist, if you aren't in an academic center where there's a lot of PAs or a lot of residents, you will still be doing the grossing and still continuously be exposed to that kind of material. So unfortunately, these are the cons of pathology. It depends. Like I said, some people might see some of the cons as a positive. For me, having subspecialty sign out is a huge plus because I've learned in pathology. I really love to do GI, and I really don't enjoy doing any other subspecialties. So I'm glad I get to subspecialize. I'm glad I got to do a fellowship and I could sign out GI exclusively now. I am glad that we don't have patient interaction. I went into med school thinking I was going to be a family medicine doctor because I thought it would be a great time to treat and help prevent disease and also, give patient education. And after my clerkships, I was like, nope, never again. I really don't care if I never talk to another patient again. And pathology did it for me. Now I don't ever have to go and see a patient or touch a patient at all, and I love it. So like I said, these are the cons that are commonly talked about in pathology, and if you don't mind these cons, then this really could be the subspecialty for you. So I hope you guys, I hope I didn't turn too many of you guys off from pathology because it's honestly a great subspecialty. So I guess I'll just leave it off here for today. And once again, I hope you guys have enjoyed my channel and the content I make, and I would really appreciate it if you would like and subscribe and hit that notification bell so that whenever I make a new video, you guys will be notified and be able to watch right away. So that's it for me today, and I hope to see everyone next time. Bye!